how can we engage family physician and primary care professionals in the improvement of chronic disease management? And actually, the context of this project was that we had a team at the Montérégie agency who was called the performance team, who had the expertise to extract data from administrative database. And this allowed us to maybe be able to provide feedback to healthcare professionals on their practice. So we wanted to be able to use this information that was usually sent to managers, but we said, can we develop a bottom-up approach and try to get these people involved in quality improvement? So we developed an intervention, and that took the format of interprofessional reflective workshops. So we bring together physicians, nurses, community pharmacists, and other healthcare professionals around the same table, and we presented them these results, and we asked them to identify gaps between their actual practice and what they think would be the best practices based on clinical guidelines. And we get these professionals to develop quality improvement plans that we hope they're going to implement in practice. And actually, we're trying to make some improvement in our intervention to provide support to these teams to implement these quality improvement projects in their context. But at one point, with the idea of Dr. Rodrigue and other people on our team, we said, is it possible to engage patients in this process, in the quality improvement of chronic disease primary care? And can we adapt the workshops that we develop for professionals for patients? So since we had started with providing workshops for professionals on diabetes, we did the same thing with patients. So we call these workshops the COMPAS-PEP workshops for patient engagement project. And the objective of these workshops were to enable diabetic patients from the same community to learn about the health and support services offered in their territory, to verbalize their needs and the solution they envisage for to improve services delivered to diabetic population, to try to get them engaged in the process of improving services offered to persons with diabetes. And one of the most important part of the project was to formulate recommendations that will be used by the various decision-making bodies in the local and regional networks. So you see, we had at the same time an objective of trying to empower patients in order to help them have a better knowledge of the services offered in their area, but also try to get them engaged in the process of quality improvement, but also to use the information that they would be providing us to try to influence professionals and managers. So what did we do? We did a descriptive study using mixed methods. So the first phase of the project, the main aim of this phase was to adapt the workshops that we had developed for professionals to adapt them for patients. So we collaborated with 2 patients to support us in this process. And we decided in this project also to come closer to the chronic care model, to collaborate with the local diabetes patient association in this project. And they helped us organize and recruit patients to deliver the workshops. And what we did was that we recorded the content of the workshops, and we asked the patient to complete a questionnaire after the workshops and 1 month after the workshop. During the phase 2, what we did is we wanted to develop a dissemination strategy to try to make managers and professionals knowledgeable of the results that we collected. So we wrote a project report that we wanted to disseminate, and we made sure that we had the feedback from local diabetes patient association on this report before sending it. And we developed a dissemination strategy. So we went to do multiple presentation to different committees at the agency where managers, middle managers get together. So the regional direction of general medicine, the clinical administrative network, the table of professional services director, and nursing services director too. And we also went to do a presentation in the diabetes teaching centers in all the different healthcare organizations in Montérégie. So the report was sent by email, and the presentation were given face-to-face. And in order to collect data on this phase of the project, we administer a questionnaire 3 to 6 months after the result dissemination. So just to let you know a little bit, the format of the workshop that was delivered to patients was composed of 4 activities. So what we did is that when patients were coming to the workshop, we first had with them a large group discussion in order to help us identify needs and challenges they were experiencing as a diabetic patient. Afterwards, we invited the chronic disease coordinator of the healthcare organization to come and present to the patient the services that are offered to diabetic patients in their area to increase their knowledge about the service already offered, and in order also to make them more critic during our discussion about what is available and what is not available to them according to their expressed needs. We also use the information available in the administrative database in order to provide patients with a profile of the diabetic patient characteristics of the patient in their area, and also to provide them with numbers of their use of healthcare services. So we would tell them how many patients consulted the emergency during the last year, how many of them have a family physician, the average number of times they saw this physician during the last year. So after this, we divided the large group into smaller group discussion in order to really be able to gather information on patient care experience, quality improvement needs they can identify, and the proposed solution they had to improve diabetes patient services. So what did we do at our results? So we were able to do 6 workshops. So we were able to target 7 out of 11 CSSS in Montérégie, and we had 79 patients participating to our workshops. So maybe the main characteristics that I want to highlight on our participants was that these people were living with diabetes for an average of 13 years. So we had people who had a great knowledge and experience of knowing how to live with the diabetes. So that was very interesting because it gave us another perspective, because we know that a lot of the education and a lot of services are provided to diabetic patients when they get their diagnosis the first time. But these people were really able to give us more information on the amount of support and the amount of follow-up and access to services that they have managing their chronic condition. So we were able to identify the needs and challenge of the patients and group them into 7 teams. So the 7 teams that we found were challenges related to accessibility and continuity of care, physical health problems, motivation to adopt and maintain health-related behavior on a long-term base, psychological challenge related to living with diabetes, keeping their knowledge up to date, because when you've had the education 10 or 12 years ago, you need to keep your knowledge up to date to what is now known about what are the best treatment, how I should be taking care of myself. Economic challenges also, and linking actions between primary and secondary care. So I don't have the time to present to you all the needs and the solutions that were brought up by the patient, but I just wanted to highlight some of the points. So related to accessibility and continuity of care, for example, Patient told us that it was very important to them to have a good follow-up by their physician, and one part of that was being informed of their exam results, and we talked about this morning, that was important to patient. Also, patient said that it was really important to them to understand what was the role of each professional involved in the team, and that the pharmacist was a professional that could particularly support them, but they didn't have a clear idea of how this person could really support them. One solution that they saw was that probably if we centralize all the services at the same place, it would be easier for them to know what's available and where they need to go to have access to the care. And also if we could inform them better on the role of each professional. Another challenge that came out a lot in our results was the psychological. We talked this morning also about social care and how it is important. The diabetes patient on our project told us that psychological support was very important to them, but it was difficult for them to have access to these services, and also to have services that can support family and partners, because they are very involved in supporting them in dealing with their diabetes. So if we look at result on patient empowerment, you can see that we had 78% of our participants said they had better knowledge of services available in their healthcare institution. 83% said they wish to make better use of services available following the workshops. 35% at 1 month follow-up told us that they already made a change in the way they were using services, and 86% said they were able to improve their ability after the workshop to identify their own needs for different services following the workshops, and 93% said the workshop also improved their awareness of needs experienced by other people suffering from diabetes. Our outcomes related to patient engagement after the workshop, 97% of our participants said they thought it was possible to improve diabetes services, and 91%, I guess they probably hope, that their participation to the workshop could contribute to the improvement of services. At the 1 month follow-up, our participants, 60% expressed a desire to become involved in improving services for diabetes patients. So results related to our phase 2, so we presented these results to 5 committees at the agency and to 5 diabetes teaching centers in Montérégie. So our data collection is actually ongoing. So I'm really presenting to you some very preliminary results of this project. So up to now we have 16 respondents, but we hope we sent these questionnaires to about 80 persons. So hopefully we'll have more answers. We'll try to track the people that we send the questionnaire to so we get the result. So we have mostly physicians who answer our questionnaire up to now, 50% are manager. So you can see half of them believe that the content of the report could be useful to them before reading it. 7 of our respondents said they have the intention to use the result of the report. 6 of them said that the results already had an impact on the service they offer to diabetic patients, and 2 mentioned that they implemented some change based on the result of this report. So we asked the managers and the professional to tell us what were the challenges and needs expressed by patients that they would prioritize, and you can see that managers and professionals appear to give a priority to accessibility and continuity of care, and a motivation challenge, like keeping the motivation for adopting good healthcare behavior. Maybe what we can see is that we'll probably see a gap between what the manager and professional think of the need of the importance of psychological challenges experienced by patients. And we also ask manager and professional to tell us which solution they think is the most important and should be implemented. So you see improved self-management by communicating exam results and improvement of communication collaboration between professional for now appears to be the most important solution perceived by manager and professional. So, in conclusion, we found that patients are not often well informed or services offered by their health organization, and this can have a negative impact on their health. The most important challenge faced by patients with diabetes are being proactive in the management of their diabetes and keeping ongoing motivation. We saw that there is probably a clear lack of collaboration between community resources and healthcare services, and we hope that this project maybe help strengthen the links between the community and the healthcare organization. Just to give you a little idea of the spin-off of this project, we've decided to make some changes to the format of our workshop that we give to professionals in order to include patients to these workshops, so they will be able to directly interact with professionals thinking about quality improvement projects. And I think we also want to promote the use of this form of workshop, and we hope that chronic disease manager, coordinator in Montérégie will be able to organize this kind of workshop in their area, maybe once a year, once per 2 years, for a different chronic disease in order to have a better understanding of the needs and solution perceived by patients. So we want to acknowledge also all our participants to the project and the Canadian Foundation for Quality Improvement that supported this project. Thank you.